All right, so let's go ahead and get started. The agenda for this session includes the purpose of this training, an overview of BadgerCare Plus, including the non-financial and financial rules, and finally, resources. Before we dive into today's training, you should have received a PDF handout titled Forming a BadgerCare Plus Magi Group, as Elizabeth just mentioned. The PDF is also posted on the conference website. You will need that handout when we get to some examples of how to determine a BadgerCare Plus Magi Group household size. So if you weren't able to print that handout out before, I would encourage you to either print it out now quick, or if you have an additional screen, you could view it on your second screen when we get to that part of the session, but you are going to want to have that up when we get there to help walk through those scenarios. The purpose of this training is to provide navigators, certified application counselors, or CACs, partners, agents, and brokers with an overview of the eligibility rules for BadgerCare Plus. So let's take a look at an overview of BadgerCare Plus eligibility rules. Before we do, please keep in mind that this training provides an overview of the eligibility factors that will be considered for BadgerCare Plus. It's not intended as a training on how to determine eligibility. Only income maintenance or IM agencies can determine eligibility for most programs. The policies described in this training are subject to change, and updates are available at the links shown on this slide. The first takes you to a page that provides links to different healthcare program information, and the second link takes you to a page where you can sign up to receive email updates regarding DHS programs and services. BadgerCare Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant people, and childless adults ages 19 through 64 who are not receiving Medicare, except Medicare Part B immunosuppressive drug benefit, known as Part B ID. BadgerCare Plus is a state and federal program that provides health care coverage for low-income Wisconsin residents. BadgerCare Plus is funded by Medicaid or Title 19 and the Children's Health Insurance Program, or CHIP, or Title 21. Most of the BadgerCare Plus populations are funded by Medicaid, but some higher income children and the prenatal program are funded by CHIP. CHIP is primarily a program covering low-income children's health care needs. CHIP also covers pregnant people who are enrolled in the BadgerCare Plus prenatal program. Let's take a look at the non-financial rules for BadgerCare Plus. Individuals must fall into one of these groups to qualify for BadgerCare Plus. They must be a child age 0 through 18 years old, a parent or caretaker relative who lives with and cares for a child age 0 through 18 years old, and there's no age limit for the parent or caretaker relative caring for the child. A pregnant person, again, no age limit, or a childless adult. A childless adult is a person aged 19 to 64 years old who's not receiving Medicare, except Medicare Part B ID, and who does not have any dependent children younger than 19 years old who reside with them at least 40% of the time. Marital status has no effect on a person being a childless adult. As I mentioned earlier, the healthcare benefits for some children with higher household incomes are funded through the Children's Health Insurance Program, also known as CHIP. This includes children ages 1 to 5 with income above 191% of the federal poverty level, or FPL, and children ages 6 to 18 with income above 156% of the FPL. As a result, they are subject to different rules regarding backdated coverage and substitution of group health plan coverage policies. Additionally, to qualify for BadgerCare Plus, individuals must be a Wisconsin resident, physically present with an intent to reside in Wisconsin, be a U.S. citizen or qualifying immigrant, provide their Social Security number with some exceptions, and supply required information and verification within the required time frame. Finally, they must meet the substitution of group health plan coverage rule when this policy applies. So children with higher incomes may not qualify if they have coverage through certain employer-sponsored health insurance coverage. And some pregnant people who are immigrants or who are incarcerated may not qualify if they have coverage through a health insurance plan which qualifies as minimal and essential coverage. That's going to bring us to our first poll question already. Question 1, what population does not qualify for BadgerCare Plus? A, pregnant people, B, a child under age 19, C, parents and caretaker relatives living with children under age 19, D, childless adults ages 19 through 64, or E, people ages 19 through 64 who are receiving Medicare, not including Part BID. So what population does not qualify for BadgerCare Plus?
And we'll just give that another 10 seconds or so and then close out that poll.
Sounds good. Awesome. Looks like the majority of you did select the correct answer. The correct answer is E. People who are ages 19 through 64 who are receiving Medicare, except Part BID, are non-financially ineligible for BadgerCare Plus. However, they may be eligible for EBD Medicaid, which we'll be talking about in our next session. All right, let's talk about the financial rules for BadgerCare Plus. Financial eligibility is based on the household's expected monthly income. In some circumstances, annual income may also be considered. Assets are not considered when determining eligibility for BadgerCare Plus. Let's talk about those income limits. The federal poverty level, or FPL, is a federally determined income amount that's scaled based on household size and is usually adjusted every year. The FPL amounts seen here were effective February 1st, 2025, and can be found at the link shown on this slide. The income limit for adults is at or below 100% of the FPL for the appropriate household size. For children and pregnant people, the income limit is at or below 306% of the FPL for the appropriate household size. People whose income is too high to be eligible for BadgerCare Plus may be eligible for advanced premium tax credits, or APTCs, through the marketplace. APTCs can help lower monthly insurance payments when enrolling in a health insurance plan through the marketplace. Since this session is specifically about BadgerCare Plus, we won't be going into details about APTs and health insurance through the marketplace. Modified adjusted gross income, also known as MAGI rules, are used to determine household size and household income for BadgerCare Plus. MAGI rules are also used when determining eligibility for APTCs at the marketplace. Using MAGI rules, IM agencies determine how big the household is, also known as household size, which household member's income is counted, and what types of income and deductions are counted. That's going to bring us to our second poll question. Question 2, the income limit for BadgerCare Plus for pregnant people is what percent of the FPL? A, 100%, B, 150%, C, 200%, D, 256%, or E, 306%. The income limit for BadgerCare Plus for pregnant people is what percent of the FPL?
And we have just about 5 seconds left in that poll.
Awesome. Great job. The correct answer is E. The income limit for BadgerCare Plus for pregnant people is 306% of the FPL. All right. So let's move on to how the household size is determined for Magi rules, which can be kind of complex. In some cases, the household size is based on who plans to file taxes and whom they plan to claim as tax dependents. These are called tax rules. In other cases, household size is based only on how the household members are related to each other. These are called relationship rules. As a result of these rules, different household members can have different household sizes. Additionally, for any pregnant people included in a given household, the household size is increased by the number of babies expected. Now, verification of pregnancy is not required unless the IM agency has information that contradicts the person's statement. So at this time, we're going to be walking through some examples of how to determine a BadgerCare Plus Magi group's household size. So please either go ahead and pull out your printed version of the Forming a BadgerCare Plus Magi group PDF that we talked about earlier, or bring it up on a separate screen because the PDF is going to walk us through a logic flow that will help us determine the correct household size. All right. In most cases, if an adult in the household is planning to file taxes and is not being claimed as a tax dependent by anyone else, the household includes the tax filer, their spouse, and their tax dependents. So let's take a look at our first example. Joe and Liz are married and have 2 young sons, Matt and Leo. Liz is pregnant. Joe and Liz plan to file taxes jointly and claim both children as tax dependents. So using our handout, let's use Joe as the target. So first we ask ourselves if Joe is planning to file taxes, and he is. So then we ask if he will be claimed by anyone else as a tax dependent, and he won't be, so the answer is no. That's going to bring us to the next block, which is if no, include the target, which is Joe, the target spouse, which is Liz, and all of the target's tax dependents, which is both children, Matt and Leo. So we're currently at a household size of 4. But then it says that if there's a pregnant person in the group, include the number of expected babies and count only 1 if the number is unknown. So we know Liz is pregnant. We're going to assume she's only pregnant with 1 baby. So Joe's household size would be 5. Joe, Liz, the expected baby, Matt, and Leo. Liz's household size would also be 5 if we use her as the target. And if we look at one of the children as the target, we get the same result. So let's just use Matt and start back at the top of our flow. Is Matt expecting to file taxes? No, he's a child, doesn't have a job or any income. So if no, we see to go to step 3. Step 3 asks, is anyone else claiming the target as a tax dependent? And the answer to that is yes, right? Joe and Liz are filing taxes, claiming both the kids as tax dependents. So if yes, then is the target living in one household with both parents who are not filing taxes jointly? And we just discussed that. The answer is no, because the parents are filing taxes jointly. So then we drop down to if no, will the target be claimed by a parent living outside this household? And again, the answer to that is no. And then it says, if no, then the target's Magi household group will be the same as their tax filers group. So Max's tax filer is Joe and Liz, since they're filing jointly and claiming both children. Joe and Liz's household group we said was 5. So Matt's group, as well as Leo's, will be 5, the same as their tax filer. I do just want to mention that the CARES Worker Web System, or CWW, does determine these groups automatically for the IM worker, but it's based on the information communicated in the application, which is why it's so important that those relationships are identified correctly when submitting the application. Moving on to example 2, we have Rich. Rich is a single adult who lives with and provides financial support to his elderly mother, Maggie. He plans to claim Maggie as a tax dependent. We're going to let you practice on this one. So I'm going to give you a bit to look at your handout and see if you can identify Rich's household size on your own. And then I'll give you the answer and we'll walk through it together. So take a couple minutes to walk through the handout, just jot down or keep in your mind what you think the answer will be. All right, how are we feeling? Ready for me to walk through this one? All right, I got some thumbs up. Thank you. All right, so first we ask ourselves, is Rich planning to file taxes? And he is. So then we ask if he will be claimed by anyone else as a tax dependent, and he won't be. So the answer is no, which brings us to the next block, which is if no, include the target, which is Rich, the target spouse, and he doesn't have one, and all of the target's tax dependents, which is Maggie, right? So Rich's household size is 2, Rich and his mother Maggie, since he plans to claim her as a tax dependent. Now let's talk about relationship rules. In most cases, if an adult in the household is not planning to file taxes, the household includes the adult, their spouse, and their children under age 19 who are living with them. So let's take a look at example 3 together. Mike and Kelly are married and have a young daughter, Fiona. Mike and Kelly do not plan to file taxes. So using our handout, let's use Mike as the target. First, we ask ourselves, if Mike is planning to file taxes, and he is not. So we then see that if no, go to step 3 and ask, is anyone else claiming Mike as a tax dependent? And the answer again is no. Nobody else is claiming Mike as a tax dependent. And we see if no, go to step 4, which is to use relationship rules. And that block tells us if they are living in the home, include the target's spouse and their children under age 19. It then goes on to speak about if the target is actually under age 19. So we're going to stop there for now because Mike is over age 19. So that means that Mike's household size is 3. Mike, his spouse, Kelly, and his daughter under age 19, Fiona. And Kelly's household size would be the same. Let's look at Fiona's household size. Starting again from the top of our handout, Fiona is not expecting to file taxes. So we'll go to step 3. Nobody else is claiming her as a tax dependent. So that takes us to step 4, which again is relationship rules. So we'll count the target spouse and their children under age 19. Fiona's a child. She doesn't have a spouse or children. Moving on, though, we see that if the target is under age 19, which Fiona is, then we'll include her parents and siblings under age 19 if they're living in the same household. Both of Fiona's parents are in the household, and she doesn't have any siblings, so her household size will also be 3. All right, moving on to example 4. Lars and Laura are childless adults who live together but are not married. Laura is pregnant. Neither is filing taxes. I'm going to give you a bit to look at your handout and see if you can identify both Lars and Laura's household sizes. And then we'll walk through it together and I'll give you the answer. So go ahead and take a couple moments, jot down what you think the answer will be. What is Lars's household size and what is Laura's household size? All right, how are we feeling? Are we ready to move forward? If not, that's fine. I'm going to wait for some thumbs up before I move forward. Oh, I got one. All right, looks good. All right, so let's take a look at Lars first. First, is Lars expecting to file taxes? No. Is anyone claiming him as a tax dependent? No. And he doesn't have a spouse or any children under 19 in the household. So his household size is 1. Now let's look at Laura. Is Laura expecting to file taxes? No. Is anyone claiming her as a tax dependent? Also no. Does she have a spouse or any children under 19 in the household? Again, no. Is she pregnant? Yes. So we would add her expected baby to her household size, and Laura's household size would be 2. Now, relationship rules are also used for children who are claimed as a tax dependent by someone other than their parent, children who are claimed as a tax dependent by a parent who lives outside of their home. This will often happen with divorced parents, and children who live with both parents, but those parents are not filing jointly. That was our Lars and Laura situation. When relationship rules are used for children under age 19, their household includes parents who are living with them and siblings under age 19 who are living with them. And again, we already saw that when looking at other household members in our prior scenarios, but let's go ahead and take a look at a few more. Example 5. Jaden, Rylan, and Warren are teenage brothers, all under 19, who live with their Aunt Sarah. Sarah plans to file taxes and claim all 3 brothers as tax dependents this year. So let's walk through this first one together. First, with Sarah as the target, starting from the top of our handout, is Sarah expecting to file taxes? Yes, so we know we'll be using tax filing rules. Will Sarah be claimed by anyone else as a tax dependent? No. So we'll include Sarah, her spouse, and she doesn't have one, and all of her tax dependents, which would be all 3 nephews. So Sarah's household size is 4. Now let's use any one of the brothers as the target, starting from the top of our handout. Is he expecting to file taxes? No, so we'll go to step 3. Is anyone else claiming him as a tax dependent? And the answer is yes. Is the tax filer his parent or spouse? And the answer to that is no. So we'll go to step 4, which is relationship rules, and includes, if they are living in the home, his spouse and children, and he doesn't have a spouse or children. And if under the age of 19, which he is, will also include his parents, neither of the parents are in the home, and his siblings under age 19. And he has 2 siblings under age 19 in the home, so each brother has a household size of 3, himself and his 2 brothers. Hey, for example 6, we have Jocelyn. Jocelyn is divorced and lives with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, plans to claim Maisie as a tax dependent this year. I'm going to give you a bit to look at your handout and see if you can identify both Jocelyn and Maisie's household sizes, and then we'll walk through them and I'll give you the answers. So go ahead and take a couple minutes to walk through those and jot down your answers for Jocelyn's household size and Maisie's household size. Okay, how are we feeling? We need a little more time. Are we ready to go? Thumbs up if you're ready. All right, I'm seeing some thumbs. Awesome. Okay, so Jocelyn first, starting at the top of our handout. Is Jocelyn expecting to file taxes? Yes. Will she be claimed by anyone else as a tax dependent? No. So tax filing rules are used and will include Jocelyn, her spouse, if living in the home and filing jointly and she doesn't have one, and all of her tax dependents, and she doesn't have any. So using tax rules, Jocelyn's household size is 1 because she's a tax filer with no tax dependents. Now let's look at Maisie's household size. Starting at the top of our handout, is Maisie expecting to file taxes? No, so we go to step 3. Is anyone else claiming her as a tax dependent? Yes. Is the tax filer her parent or spouse? Again, yes. Does she live in the household with both parents who are not filing taxes jointly? And the answer to that is no, because both parents don't live in the home. So then, will she be claimed by a parent living outside this household? And the answer is yes. So we go to step 4, which is relationship rules. And we include if they are living in the home, her spouse and children under 19. She doesn't have a spouse or children. Since she's under age 19, we include her parents and siblings under age 19 if they're living in the same household. Since Maisie's mother, Jocelyn, is living in the household, she is added to her household size. So, because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie, and Maisie's household size is 2, herself and her mother. All right, here's our last example. Example 7. Dan and Jackie live together but are not married. They have 10-year-old twins, Sadie and Lily. Dan plans to file taxes and claim both children as tax dependents. Jackie also plans to file taxes. I'm going to give you a bit to look at your handout, see if you can identify Dan's household size, Jackie's household size, and the children's household size. So go ahead and take a few minutes and jot down your answers. I feel like we should have the Jeopardy theme music playing when we're waiting. That's what I hear in my head anyway. How are we feeling? Are we? I'll wait for a thumbs up for ready to go. All right. All right. So starting at the top of our handout, is Dan filing taxes? Yes. Is he being claimed by anyone else as a tax dependent? No. So tax filing rules are used, and we include Dan, his spouse if living in the home or filing jointly, and he's not married, and all of his tax dependents, and he's claiming both children. So using tax rules, Dan's household size is 3 because he's a tax filer with 2 tax dependents. Now for Jackie, starting at the top of our handout. Is Jackie filing taxes? Yes. Is she being claimed by anyone else as a tax dependent? No. So tax filing rules are used. And we include Jackie, her spouse, if living in the home or filing jointly, and she's not married, and all of her tax dependents, and she doesn't have any. So using tax rules, Jackie's household size is 1 because she's a tax filer with no dependents. Now let's look at the twins. Starting at the top of our handout, is the child filing taxes? No. Are they being claimed by anyone else as a tax dependent? Yes. So we go to step 3. Is anyone else claiming them as a tax dependent? Yes. Is the tax filer the target's parent or spouse? And the answer is yes. The tax filer is the children's father, Dan. Do they live in one household with both parents who are not filing taxes jointly? And the answer to that is yes, right? Both parents are in the household, but they're not filing taxes jointly. So we go to step 4, which is relationship rules. And we include, if they're living in the home, their spouse and children under 19, and the children aren't married and have no children of their own. They're both under age 19 though, so we do include their parents and siblings if they're living in the same household. Since they are siblings and both parents live in the household, for the twins, relationship rules are used because their parents are living together but not filing jointly. So each child's household size is 4. It includes the child, her sister, and their 2 parents. So to wrap up our conversation about household size, here are just a few additional notes. Tax dependents can be included in someone's household size, even if they're living outside of the home or are deceased. Tax filers can claim a deceased child as a tax dependent or a deceased spouse as a tax co-filer in the year they passed, and they would be included in the tax filer's group size. Spouses must always be included unless they're living separately and filing taxes separately. To be considered to be living with a parent, a child under age 19 must be in the parent's home at least 40% of the time. If parents are divorced, only one parent can claim the child as a tax dependent each year. And tax rules are based on how the person plans to file taxes for the current tax year. More information about households can be found in BadgerCare Plus Eligibility Handbook, Chapter 2.3, and the link to that handbook is shown on this slide. Also, the flowchart we provided as a handout today can be found in the handbook in Chapter 2.3.3. All right, time for our next poll question. Question 3. Relationship rules are not used for the indicated individual in which scenario? And here's a hint. Households, again, may have some people under tax rules, other people under relationship rules. So only think about the tax rules or relationship rules if they're used for the specific individual described in each scenario. So the question again is, relationship rules are not used for the indicated individual in which scenario? In other words, which one of these will use tax rules instead of relationship rules? A, an adult in the household who is planning to file taxes and is not being claimed as a tax dependent. B, an adult in the household who is not planning to file taxes. C, a child who is claimed as a tax dependent by a parent who lives outside of the home. Or D, a child who lives with both parents, but those parents are not filing jointly. Again, relationship rules are not used for the indicated individual in which scenario. So which scenario has tax filing rules? I'll give you a little time. If I could sing, I'd hum the Jeopardy music, but I think everyone might like log off. So
All right, we'll have just about 10 seconds left in that poll, and then we'll go ahead and close that.
All right, that was kind of a tricky one, wasn't it? Looks like we do have the majority of the people that voted did vote for the correct one. The correct answer is A. When an adult in the household is planning to file taxes and is not being claimed as a tax dependent, tax rules will be used to determine household size, not relationship rules. All the other individuals described would use relationship rules. All right, next let's talk about income. First, let's talk about whose income is counted. In general, all household members' income is counted. However, if a household member is a child or tax dependent of another household member, their income is only counted if they're expected to be required to file a tax return for the current year. Expected to be required includes children or tax dependents who expect to have more than $15,000 in earned income or more than $1,350 in other income for the tax year. And you might want to jot down those facts for our example. $15,000 in earned income or more than $1,350 in other income for the tax year. So for this expected to be required rule for children or tax dependents, other income does not include child support, Social Security, supplemental security income, also known as SSI, workers' compensation, veterans benefits, money from another person, or educational aid. So if the child or tax dependent is receiving these types of income, they are not counted when determining if a person meets those thresholds and is expected to be required to file a tax return. Not necessarily that the income will be counted in the eligibility determination, and we're going to talk about what type of income is counted in a bit. These thresholds are updated annually, and the thresholds on this page were effective January 1st, 2025. So let's talk about this in the context of an example. And we're going to go back to example 6. Remember, Jocelyn was divorced, lived with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, who doesn't live in the home, plans to claim Maisie as a tax dependent this year. Using tax rules, Jocelyn's household size is 1 because she's a tax filer with no tax dependents. Because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie. Maisie's household size is 2, herself and her mother. Maisie has a part-time job at McDonald's and is earning approximately $400 per month. So you might want to jot this down. Jocelyn's household size is 1, just herself. Maisie's household size is 2, herself and Jocelyn. And Maisie has earned income of $400 a month or $4,800 for the year. So for Jocelyn's eligibility, since we'll use tax filing rules for her, her household size is 1 and only her income is counted for her eligibility. And for Maisie's eligibility, since we'll use relationship rules, her household size is 2. So her mother's income will be counted. However, since Maisie is the child of another household member, her income is only counted in her eligibility determination if she's expected to be required to file taxes. So let's look at that. Remember, Maisie's only income is from her job, and she only earns approximately $400 per month. So she expects to earn approximately $4,800 this year from her job. That is below the expected to be required to file threshold, which we said was currently $15,000 in earned income per year. So her income is not counted in her eligibility determination. And I want to mention it's not counted even if she chooses to file taxes. The fact that she's not expected to be required to file supersedes whether she chooses to file or not. Therefore, only Jocelyn's income will be counted for Maisie's eligibility. Now, if Maisie were to earn $1,400 a month from her job or $16,800 a year, she would be above the threshold of $15,000 and her income would be counted for her eligibility in addition to Jocelyn's income. Or if Maisie had other taxable unearned income, for example, let's say she had $1,500 in unearned income, interest income for the year, that $1,500 of other taxable unearned income would be counted for her eligibility in addition to Jocelyn's income, since it's more than the $1,350 threshold for taxable unearned income. But remember, neither of those would still count for Jocelyn's eligibility because Jocelyn's a household of one, just herself. So now that we know whose income is counted, let's move on to what income is counted. Most taxable income is counted for BadgerCare Plus. This includes, but is not limited to, taxable gross earnings from a job, taxable earnings from self-employment, unemployment compensation, student financial aid if used for living expenses, taxable retirement, pension and annuities, and interest and dividends. I want to point out that Social Security income is usually not taxable, but is counted for BadgerCare Plus, unless it's income of a child or tax dependent under the income limit for that special expected to be required to file rule. Now let's take a look at what income is not counted. Examples of common types of income that are not counted for BadgerCare Plus include child support, alimony, spousal support, or maintenance payments received under separation or divorce agreements completed after January 1st, 2019, supplemental security income, also known as SSI, gifts or other money from another person, workers' compensation, and veterans benefits. A full list of income that is not counted is available in BadgerCare Plus Eligibility Handbook, Chapter 16.2. Next, let's talk about deductions. A deduction is an amount that can be subtracted from the amount of income used to determine eligibility. Pre-tax paycheck deductions are allowed as BadgerCare Plus income deductions. An example of that would be pre-tax contributions to a health savings account. Tax deductions listed on IRS Schedule 1 Form 1040 are also allowed. Examples include student loan interest paid and self-employment tax. Itemized deductions like mortgage interest and charitable contributions are not allowed. A full list of income deductions can be found in BadgerCare Plus Handbook, Chapter 16.3. And that brings us to another poll question. Question 4. What type of income is not counted for BadgerCare Plus? A, Social Security payments, B, child support payments, C, taxable earnings from self-employment, D, unemployment compensation, or E, taxable gross earnings from a job. What type of income is not counted for BadgerCare Plus?
All right, we'll give it just another 10 seconds for that poll, and then we'll close that out.
Awesome, great job. The answer is B. Child support payments are not counted as income when determining BadgerCare Plus eligibility. All right, now let's talk about some special situations, which include 12-month continuous health care coverage for children, continuous eligibility for pregnant people, continuous eligibility for newborns, presumptive eligibility, also known as express enrollment, gap filling, former foster care youth, income extensions, BadgerCare Plus emergency services, BadgerCare Plus prenatal program, and family planning only services and premiums. The Consolidated Appropriations Act 2023 mandated that members who are under age 19 will keep their coverage until it has been 12 months since their last application or renewal, with some limited exceptions. Prior to this act, if a family had a change in income or other circumstances, children in the household could lose their coverage because of that change. Now, children will stay enrolled at least until their next renewal, again with some limited exceptions. The 12-month continuous coverage period starts with the month of application, the new certification period at renewal, or when the child otherwise becomes eligible under a qualifying group. Backdated months at application and renewal do not count toward the 12-month continuous coverage period. So a child only eligible for one or more backdated months, but not the month of application or ongoing, does not qualify for a 12-month continuous coverage period. Children under age 19 in the programs shown on this slide are eligible for 12 months of continuous coverage. Continuous coverage does not apply to children who are enrolled under presumptive eligibility, also known as express enrollment, or those required to meet a deductible to enroll in BadgerCare Plus or Medicaid. A child could lose coverage during the 12-month period if they turn 19, if they move out of Wisconsin, if their citizenship or immigration status is not verified, if their eligibility determination was made based on incorrect information or agency error, or if the family asks to end their coverage. Now, there are a couple of other circumstances in which members are considered to have continuous eligibility. They include pregnant people who become eligible for BadgerCare Plus. This does not include people who are eligible for the BadgerCare Plus prenatal program, which we'll talk about later. These pregnant people stay eligible through the end of their pregnancy, and they're also eligible during a postpartum period that lasts until the end of the month in which the 60th day after the end of the pregnancy occurs. So birth, go forward 60 days, the end of that month is when their continuous eligibility would end for the pregnant person. And babies who are born to a mother enrolled in BadgerCare Plus or Medicaid. So mom must be receiving BadgerCare Plus or Medicaid at the time of the child's birth for this continuous eligibility to apply to the baby. These babies stay eligible for BadgerCare Plus until they turn 13 months old. These eligibility periods for pregnant people and newborns continue even if the household's income goes over the program's income limit. Presumptive eligibility, often abbreviated as PE, is also known as express enrollment, often abbreviated as EE, or temporary enrollment, often abbreviated as TE. Honestly, we're not trying to confuse anybody. It's just that sometimes different partners may call a program by a different name, and we want to make sure you know that whether you hear it called PE, EE, or TE, they're all talking about the same program that provides this express temporary enrollment based on the presumption of eligibility established from household and financial information provided by the applicant to the partner, provider, or qualified hospital. So presumptive eligibility is a streamlined online application for BadgerCare Plus or family planning only services that's facilitated through partners, providers, and or qualified hospitals. And I want to mention that presumptive eligibility is not the same as presumptive disability. We're going to talk about presumptive disability briefly in the session on EBD Medicaid rules in our next session. So let's talk about presumptive eligibility. Presumptive eligibility provides up to 60 days of benefits, and the individual must submit a regular application for healthcare or FPOS if they want ongoing benefits. And presumptive eligibility is available to children who are younger than age 1 at or under 306% of the FPL, Ages 1 through 5 at or under 191% FPL, and ages 6 through 18 at or under 156% of the FPL. Presumptive eligibility is also available to pregnant people, parents or caretaker relatives of children ages 0 through 18, and childless adults under age 65. More information about non-financial rules and income limits for presumptive eligibility can be found in the BadgerCare Plus Handbook in Chapter 32. As a reminder, 12-month continuous coverage does not apply to children enrolled in presumptive eligibility. Next, we have information about gap filling. In most cases, eligibility for BadgerCare Plus is based on monthly income. At the marketplace, eligibility for advanced premium tax credits or APTCs is based on expected annual income. Only people with household income above 100% of the FPL are eligible for APTCs. So someone can be ineligible for BadgerCare Plus because of high monthly income, but also ineligible for APTCs because of low annual income. Here's an example. James is unemployed for most of 2025, but starts a job in October earning $3,000 a month. As a single adult, he's well above the monthly income limit of $1,304.17 for BadgerCare Plus. But his annual income is only $9,000, which is below 100% of the FPL for the year and makes him ineligible for APTCs at the marketplace. In situations like these, individuals can enroll in BadgerCare Plus based on their annual income. This type of enrollment is called gap filling. Applicants and members found eligible under gap filling rules are certified under a 12-month eligibility period, like other BadgerCare Plus members. This rolling 12-month certification period can start and end any month of the year. This allows members to keep their certification period even if they change from having their eligibility determined under monthly income rules to annual income rules when they report changes. Because 12-month certification periods often extend over 2 calendar years, the member's expected annual income will be collected at the beginning of a new year so that IM can determine if the member will continue to be eligible in the new year under gap filling rules. By expected annual income, we mean the amount of income the person thinks they're going to receive in the new calendar year. Since people have not received this income yet, they may just need to give their best estimate. And of course, verification of next year's expected annual income is not required since they likely won't have any proof of income they haven't received yet. There are some situations where a person applies at the marketplace and is told their annual income is too low for APTCs. But when their eligibility is determined for BadgerCare Plus, their annual income is too high to be eligible for BadgerCare Plus under gap filling rules. In most cases, this is because they did not report all of their income when applying at the marketplace. Someone denied BadgerCare Plus under gap filling rules can provide updated income information to the marketplace or appeal their marketplace decision. Moving on to former foster care youth. Former foster care youths are people under age 26 who were in foster care, subsidized guardianship, or court-ordered kinship care when they turned 18. They may have resided in Wisconsin or any other state when they turned 18 years old. For this population, no income limit is applied when determining their BadgerCare Plus eligibility. Keep in mind that their income information may still be needed if they're included in another household member's assistance group, though. Next, let's talk about earned income extensions. When a parent or caretaker relative's earned monthly income goes above 100% of the FPL due to increased earnings, their eligibility and their children's eligibility is extended by 12 months. The parent or caretaker relative must have been enrolled in BadgerCare Plus with a monthly income at or below 100% of the FPL for at least 3 of the last 6 months prior to the income increase in order to be able to enter the extension. The extension continues as long as the household continues to meet basic non-financial rules and there's no income limit during the extension. However, if the household's verified income goes below 100% FPL during the extension, the household will go back to normal BadgerCare Plus rules. They'll no longer be in an extension. This is also known as transitional medical assistance. Moving on to BadgerCare Plus emergency services. This is a limited benefit under BadgerCare Plus program that covers services needed for the treatment of an emergency medical condition when certain individuals meet all BadgerCare Plus program rules except citizenship or qualifying immigration status and having or applying for an SSN. Children enrolled in emergency services qualify for 12 months continuous coverage. BadgerCare Plus emergency services is not available for childless adults, which are adults ages 19 through 64 who are not living with and caring for a child under age 19. Children with higher incomes, ages 1 through 5 above 191% FPL, and ages 6 through 18 above 156% FPL. And it's not available for members enrolled in the BadgerCare Plus prenatal program, which we're going to talk about next. While emergency services applications are processed by IM agencies, it's not the responsibility of the IM agency to determine if the applicant's condition is or was an emergency condition and reimbursable under BadgerCare Plus emergency services. It is the IM agency's responsibility to manually determine if the non-qualifying immigrant meets all eligibility requirements during the dates of service and certify them if they're eligible for emergency services. Medical providers who have treated a non-qualifying immigrant for emergency services may complete the Certification of Emergency for Non-U.S. Citizenship Form F01162 to verify that these services provided were to treat an emergency medical condition, and the patient can provide that to the local IM agency when applying for assistance, although the form is not required. Additionally, a provider's certification of emergency by completing that form F01162 does not guarantee reimbursement. When the medical provider submits the claim for the emergency services to the fiscal agent determines if a condition is an emergency medical condition covered by emergency services. More information about emergency services can be found at the link shown on this slide. BadgerCare Plus prenatal program eligibility is different than regular BadgerCare Plus for pregnant people, which we discussed earlier. The BadgerCare Plus prenatal program is available to pregnant people who meet all other rules for BadgerCare Plus, but do not qualify because they don't have citizenship or qualifying immigration status, or are incarcerated in a correctional facility such as a jail or prison. People are not eligible for the BadgerCare Plus prenatal program if they are currently covered by any health insurance plan that qualifies as minimal essential coverage. People enrolled in the BadgerCare Plus prenatal program do not qualify for backdated eligibility, and continuous eligibility for pregnant people does not apply to people enrolled in the BadgerCare Plus prenatal program. Family planning only services are a limited benefit plan for people of childbearing or reproductive age. It covers certain services and supplies related to family planning. The income limit for family planning only services is 306% of the FPL. The household size is always 1, and only the individual's own income is counted. Finally, let's talk about children's premiums. Children with household income above 201% of the FPL will be charged premiums except for pregnant minors, former foster care youth, children already in their 12-month continuous eligibility period without a premium, children who have met a BadgerCare Plus deductible, they won't have premiums during the remainder of their deductible period, children in a BadgerCare Plus extension, all children under age 1, including continuously eligible newborns, American Indian or Alaskan Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services, and children whose BadgerCare Plus is suspended due to being incarcerated. I want to mention that payment of a premium is not a condition of eligibility for BadgerCare Plus. Failure to pay a premium will not result in eligibility ending for BadgerCare Plus. But premium payments made will not be refunded unless a change has occurred that has reduced or eliminated the premium amount being charged. And that brings us to our last poll question. Question 5. Which of the following is a true statement regarding applicants or members eligible under gap filling rules? A, at the end of the year, members eligible under gap filling rules must reapply for BadgerCare Plus. B, the marketplace must send an application to Wisconsin that has been identified as a possible gap filling situation for gap filling rules to be used in the eligibility determination. C, an applicant or member determined eligible under gap filling rules must submit their expected annual income at the beginning of a new calendar year. Or D, applicants and members found eligible under gap filling rules have a shortened certification period, less than 12 months. So which of those following is a true statement regarding applicants or members eligible under gap filling rules?
We'll give that just another 10 seconds for the poll, then we'll go ahead and close that out.
All right, great job. The correct answer is C. An applicant or member determined eligible under gap filling rules must submit their expected annual income at the beginning of a new calendar year, although verification of the next year's income is not required. All right, to finish up, I want to provide you with some additional resources. Online policy resources such as policy manuals, handbooks, forms, and directories can be found by following the first link on this slide. And the specific link for BadgerCare Plus eligibility handbook is also shown here as the second link on this slide. And that does complete the presentation. It does look like there's one question in the question and answers. How does an immigrant verify their income if they're paid in cash and work for different individuals depending on who gives them work that day? This has come up many times. They don't have a case manager, nor do they have a supervisor who can provide a letter stating the person's income. I do not know the answer to that question. So we're going to have to take that one back. It's a great question, Denise. We're going to have to take that back and get back to you on that. Any other questions before we end the session today? If so, go ahead and type them in the Q&A. And for any new questions you might have related to Medicaid or BadgerCare Plus, you can direct them to the Forward Health Partner inbox at the email address shown on this slide. What if it is a legal refugee with no social security number? We're not going to be able to go into all the, yeah, Masiel's typing an answer to that one, I think. We can't go into all the legal refugee stuff.
Absolutely. That gets really into the weeds. We're bringing this one back, Nona.
All right.
Thank you.
Thank you. All right. Well, that does complete our BadgerCare Plus session. I think that our EBD session, help me, what time does that one start? 9:50
Yes.
maybe?
So we're gonna take about excuse me. We're gonna take about a 10-minute break. So we can be back let's say 9:53. And we will start with the EBD session. We are also going to put a link in the chat for an evaluation survey. If you could copy it or open it when you come back from your break and have it ready to go for after today's session, we would really appreciate the feedback. It really helps us in the future make some changes, what we're doing well, what we're not doing well. So yes, please fill that out at the end of today if you could. And then, yeah, we will be back at 9:53. Thank you.